Right. Good evening, everyone. I think, yeah, it's 1 minute past 6 p.m. in South Africa and 1 minute past 12 in the US. So let's get going. Firstly, welcome to this next installment of the MedWave Smart Talk. This is now our fourth one, I think. And we're really excited about tonight's installment. We've got an awesome guest that's joining us, which we'll hear from shortly. So we're going to hear a little bit from Dr. Coertzen, and then we will also have Dr. Margot doing a short little presentation for us, touching a little bit more on the science. And then we've also got a little something special for everyone that's on this call tonight, so stick around. So yeah, let's get straight into it. Dr. Coertzen, I'm going to just ask you to introduce yourself a little bit, talk a little bit about your practice and the kind of patients that you are seeing at your practice. Remember to unmute yourself. Yeah, let's see if I can help you.
Dr. Eric, at the bottom left of your screen, there's a button that says unmute.
Andres, can you unmute? Is it possible for you to unmute her?
Yeah, I only have an option to ask to unmute. So I've clicked ask to unmute. So Dr. Eric, at the bottom left, when you move your mouse to the bottom of your screen, there's going to be options to turn your video on and off, and then your audio on and off. You just need to click on that audio button. If that doesn't work, then you can maybe rejoin. Franjo, do you think we should maybe get Dr. Erica to rejoin? I don't know if that will give her the unmuted option.
Okay. Dr. Coertzen, it's fine. Just exit this meeting.
Okay.
There we go. We're good.
Yay!
Welcome.
No, sorry, I'm on my iPad, and it could be the heat in Zanin, but nothing wanted to work. Okay, right, I'm ready. Okay, great. Thank you for giving me this opportunity. This was really quite I didn't plan on this, and it happened quite fast. But to introduce myself, I've been in an integrative medical practice for about almost 30 years. And so in my practice, I have introduced different modalities. I've also studied further, did homeopathy in England and France, and homotoxicology. And as my practice grew, I introduced more and more modalities in, to help, because as I keep on working, or you realize, always there's something that you just need something extra to treat people with. So I really was not planning. Like I say, I am almost 30 years in the practice, and I see every type of, I want to say, disease or patient. So it's really family, men, women, a lot of focus lately on stress as well. But I enjoy, I think, all parts of medicine. And I think for me, the focus has always been on healing and not necessarily treating. And I think that's been my motto. And I think that's probably what has drawn me to the MedWave.
That's great. Yeah, you're also speaking, around the country on these topics as well, which I've learned, and that's incredible. So it's really great to have you on here. And I just wanted to ask you, Dr. Coertzen, like what kind of interests you to introduce a technology like this from MedWave and photobiomodulation in your practice? And what was the response like when you started using that in your practice?
I think, to be truly honest, I've got a laser. I use a camera laser. I've got a beamer. I've got a bioscan. So I do have technology. And I did not really plan. I've seen the MedWave. I've read about it. So I've known about it. But I didn't plan on buying anything again because, I mean, in the medical practice, you finance everything. And to be truly honest, I've seen that it can really help because specifically, I think there's such a lot of pain and inflammation and different other, things that you sometimes really feel stuck. But there's a very passionate sister in Zanin, Sister Tanya Cherry. She's there. She can wave. And to be honest, she's the one that said, please do this. We've been working together part-time. She comes and do IV therapies in my practice. And I think she pushed me to say, okay, please do this. If you don't do this, and it's really going to help the practice, somebody else is going to do it. So I must say, although I've wanted to, I think just the fact that I didn't want to finance anything stopped me. And I'm really glad that I actually did buy the MedWave because it's making quite a difference.
That's great. Thank you, Tanya Cherry, for introducing it into your practice. That's awesome. And to have a forward-thinking nurse like that is really great. So, I mean, that's awesome. You've been using it for a while now in your practice. We would love for you to share some of the cases that you've seen, some of those interesting cases that you've shared with us. If you can share that to everyone on the call here tonight, and then the results that you've seen with the treatment with the MedWave device, specifically on these patients.
So it's been four weeks, actually maybe 5 weeks since we started. So it's really, really early days. I think one of the first things, you always start with yourself, and that's an important thing. So just by doing the first session, I felt definitely energized. I slept better, and I felt a difference in my digestive system. And I think in this 4 weeks, the things that we've seen just for patients was really amazing. So I'm going to share a few. So my brother, for instance, they came to visit 2 days after we got the MedWave, and he had to go for a shoulder operation, and so it was just like playing around. So sorry. And he immediately after he did his only 5 minutes, or 10 minutes on the lights, said, is this supposed to take my pain away? And for me, that was quite significant because that was 2 days after I, had the MedWave. And so we've got a few people that's got chronic pain. The one is my husband, and that's also a good, one of the best things, because that's the best people to actually, or the worst people to treat is sometimes a family member or a husband with a chronic pain. But he suffered from a lower back pain and a sciatic pain for a year. So if I tell you, we've done everything: physiotherapy. One of the therapies that I use is biopuncture. So we've used biopuncture. But it was really debilitating. He's a dentist, and sitting was excruciating. So, and I think the physiotherapist already sort of, they're like, and we don't know what to do anymore. And the first time that he stood on the vibration plate, I could see on his face, something changed for him. He was like, this makes me feel better. And it's 4 weeks later, and he can move his right leg, and he just feels so much better. It's the first time in a year that he can actually drive without pain. So that was really significant. One of the other patients, and I do know it was the combination of the vibration plate as well, because I understand really how fascia works, and I can, if some of you are interested, because some of the trainings that I do specifically on fascia, so I definitely know that made a difference, and there was a block, and it unblocked this fascia so that healing could take place. That was major. The other one is a patient that hasn't slept for 8 years, and she came to see me, and she was crying, and I think when you've got that much pain, and it's also due to scar tissue, you really become suicidal, and that's where she was. And I think for her, it's now 3 weeks, and she can sleep, and she is just so much better. So those two stands out for me. And I know it's the combination, but it has really changed them in the sense that their quality of life is completely different. Then digestive system was quite interesting, that almost all the people with digestive system troubles, and that's reflux, irritable bowel syndrome. My niece has been on the MedWave only once, and she's got Crohn's disease, and she felt an immediate relief. So there's and for myself as well, my stomach is just so much better. I started having symptoms of an ulcer, and that changed after one session. Then we do have our patients that energy, definitely sport, feeling better, feeling that the performance is better. Then my grandchild, he's 6 years old. You probably saw him. He quickly popped in here, seeing what I'm doing. But he had appendicitis. That was now Monday, a week ago. And we immediately started to treat him. I did, give him, I did some laser treatment as well. But we did the sonar and everything. And I think we managed to turn around. So that was for me a major thing, just to see how you can treat an acute. So of course, we watched and we made sure that, his symptoms is not getting worse. But that was really an incredible sort of just to see how it could change. Then a patient with shingles, that after 2 sessions, his pain much better. And I think almost after the first session, the shingles, it dried out, and it was just much better. So those are a few. Another one that I think really stands out, and it's also just 3 weeks, is a patient that came in, and she is just in her 50s, and she said, I feel so bad that if this continues, I think I'm going to die within the next 2 years. So I did a blood test, and her inflammatory markers was quite high. I did the highly sensitive C-reactive protein. So her whole body was just in an inflammatory response. And it's 3 weeks later, she's walking, she's just so much better. She feels positive, and she's lost weight, so I think it's just changed her whole life. So this is still an ongoing story, but I don't think I could have seen this results with anything else that I've done, or any medication that I could have given her. I have obviously given her, natural remedies and that. But so those are the things that is making me really excited.
That's really awesome. There's some really interesting cases. And what I thought was interesting that you said is, the vibration therapy and the fascia. The vibration plate is very much the supporting act here at MedWave, but I would love to hear how you utilize it and the protocols you use specifically with vibration therapy that you've just mentioned.
So just some background. So the fascia, we know now, is probably one of the most important organs in the body. It connects the whole body. So I mean, the fascia connects all our nerves, around our nerves, but the myofascia, that's the fascia around the muscle and every fiber, is our richest sensory organ. So there's more sensory neurons in the fascia than all our other senses together. So it's an incredibly important organ, and it communicates throughout the whole body. So it sends a lot of information to the brain and the rest of the body as well. And it's really closely connected to the vagus nerve, and that's nerve number 10, that controls our autonomic nervous system. So by supporting the fascia, you have a direct effect on our survival response, our brainstem and our limbic system, and it calms it down. So if you do that, immediately your body is in optimal response. And the body, the whole immune response and everything else in the body is just optimally. So I can definitely see how that plays a huge role as well. So we're still playing around with it, and finding every patient's groove. And there I can say that is Sister Tanya loves to, play around. She'll check in with me if there's anything. But the interesting thing is one of my other grandchildren, so they all around, quite a few of them are around here, so they've got the benefit. But she's only 5 years old. She stood on the vibration plate for the first time, and she was standing there, and she didn't want to get off. And we said, you can do this for 2 minutes. And so that showed me that it immediately made her feel better.
Yeah.
And so I do know that is a huge compliment, to the MedWave as well, and to the light therapy.
Awesome. Yeah, we've got 2 in our office here, and it's it really stands open and free. So we know exactly what you're saying. Yeah, we are talking to a lot of doctors, a lot of GPs, and we really pick up that there's a lot of interest around preventative care within that space. And we would love to learn a little bit from you. How are you integrating kind of this preventative care with prescribing medication? We would love to hear how it looks for you practically in your practice.
I'm just going to share. So my niece said when, like I said, she's got Crohn's disease, and she is she worked, especially during COVID, in intensive care. And her first remark was, wouldn't this be so nice to actually treat people this way rather than seeing them dying in intensive care? And that was quite profound. So for me, I feel every patient can benefit from this, because it works on so many systems, and because it works on the mitochondria and everything that's connected to that, I feel it benefits everybody.
Yeah.
And it's so, but to be able to treat people in a non-invasive way that has got a permanent response. It's not like you take a pain tablet and your migraine's going to come back, or all the other chronic medications that we're on. So I think to begin to realize that you can use your medication. So in my practice, I use medicine as well. So if you are on your blood pressure medication, I'm going to keep you on that, but I'm going to work on all the other comorbidities to see if we can better that, and we can halve your medication or maybe stop your medication. So I think I don't stop people's medication. I start the therapy and I start the MedWave, and as we continue, we decide, okay, what are we going to stop? So for me at this stage, I must say, in the practice, I recommend this for most of the people. I introduce it to them, I tell them about it, and then say, just go for an introduction and see how it works. So if that answers the question, I feel that it really complements, but it's a much more, it works towards healing and not treating.
Yeah.
And then just treat the symptoms that you have to still treat.
Yeah, that's great. And I'm thinking of obesity, I'm thinking of diabetes, I'm thinking of hypertension, and these are really common in this day and age. What have you seen with those conditions and comorbidities specifically?
Definitely, like I say, it's early days for me, but definitely a change. That apart from the fact that people can see that they are losing centimeters, so it makes them feel better. And then it helps, then they work with you. It's almost like then you can tell them, change this, do that. So that there's a change and a positive, definitely. Yeah. So I think, and I think part of this is that it's a quick change. You know, if I've seen a difference in 3 weeks, that's quite exciting. You know, perfect. So yeah.
Now that's awesome. That really excites us here, you know, in the head office as well. Before we get to Dr. Margot and her just short little presentation, I think I've got one more question, and that's just, you've had it now for what, a month, around about a month, you know, and I just want to, a lot of doctors are interested in moving into the wellness space. With looking back, you know, starting with something like photobiomodulating for one and other treatments as well, what are some tips that you can give someone that wants to move more from a prescriptive model to a preventative model?
I think one of the things that we've learned in medical school is, firstly, do no harm. And that's probably one of the reasons why I, you know, in the practice wanted to change just from a normal medical practice or just prescribing. So what you can, I think, so with this, you do no harm.
Yeah.
And it's so safe. And it is approved. I think that for me, that's important. I know that the signs are there. I know that it's super improved. So I think, and it gives you a tool that's not going to take away your patients. It's definitely going to bring in more patients. And then you're going to start to focus to do the things that really excite you as well.
Yeah. Because
it can get really, you know, if you only work with sick people, it really makes you tired. So I think the difference is that you will adapt their prescriptions often. But there's, you know, if it's especially a very chronic patient, but they'll still be on medication, but there's just going to be so much more that you can do with it.
That's great. Oh, we really appreciate you sharing that. It's just great to speak to people and hear the success stories. So please stick around if you want, Dr. Coertzen. You know, if anyone's got some questions at the end and towards you, it'd be great if you can answer it. If not, you're welcome to jump off, but we really appreciate your time. So we're going to segue to Dr. Margot, who will do a short presentation on the science. But before we get there, I'm just going to hand over to Andries for a brief minute, just to talk to you guys a little about a very exciting offer that we're going to present to everyone on this webinar, and then we'll move over to Dr. Margot.
Awesome. Thanks, Francois. So, hey, everyone. My name is Andries, Sales Director at MedWave. I'm truly excited to be sharing with you tonight an exclusive event opportunity right here tonight. So if you decide to get started before the close of business tomorrow, which is Friday, I'm going to share with you tonight how you're going to be able to unlock over 20,000 Rands worth of added value. Your time here is very precious to us. We respect your time. So we want to just give you a value offer. So first off, there's 3 parts to this exciting opportunity. First off, we've got a very exciting AI app, which we are busy developing. And Francois is going to elaborate on that a little bit more just now, but this AI app will cost about 1,000 Rand a month, and it empowers you as a medical practitioner with a whole lot of admin and helping you, you know, getting empowered with AI. It's incredibly exciting. Now, this AI app does usually cost about 1,000 Rand a month, and we're going to give you 6 months worth of free access. So that's about 6,000 Rand. Then number 2, we've got a anti-inflammatory diet cookbook. Now, this cookbook has been well read and designed with medical experts. It's worth over 4,000 Rand. It's over 120 pages long worth of anti-inflammatory recipes you can follow. And we specifically built this around the concept of SWOCO. So that's an acronym standing for following anti-inflammatory guidelines, which stands for not eating foods like heavy filled with sugar, with wheat, then bad oils, of course, and then caffeine. I struggle a little bit with that one here at the office. and then of course alcohol, right? So we're going to share that with you, that recipe guide, anti-inflammatory diet cookbooks worth over another 4,000 Rand. And then last but not least, I left the best for last. So because you joined us here tonight, everybody, you're going to get another 10,000 Rand off your MedWave package when you get started with us in MedWave. And that is a full discount off your package, right? So I'm going to share more with you about the turnkey business and practice solution right at the end. It will be about a minute long. I'm just going to demo the actual system to you. But when you get started before the close of business tomorrow, we will give you another 10,000 Rand off. So that's a total of 20,000 Rand that you will be saving. So this offer is available tonight. And like I said, by the end of close of business tomorrow for you to take hold of. And all you have to do is the following. So listen up. You just have to write the word offer to Francois at medwavegroup.com. I'm going to post that email in the chat. So you can just write the word offer to Francois at medwavegroup.com. And that's it. Thank you, everybody, for being here. Thank you for your time. And now over to our lovely Dr. Margot, our Chief Medical Officer at MedWave. We will now be sharing more. Thank you.
Thanks, Andries. Just before Margot jumps in, just a little bit on the MedX app that we've developed. It's essentially an application where you record clinical results related to pain, weight, and wounds. We make it easy for you to record those results and record the patient's details. So it started off like that, but then it's developed into, we've learned, talking to GPs and nurses, the administrative burden that you have in the practice when it comes to specifically claiming from medical insurances, motivational letters. So once you've filled in the clinical data, we automatically generate a motivational letter for you with a click of a button. It loads all the patient details, it loads the clinical results and the motivation as well with the ICD-10 codes. And then that's automatically populated and you can just send it all from there. So that's just the app in a nutshell. But if you want to learn more, yeah, please reach out. Right, Dr. Margot, are you here? Let's see if I can pick that up. All right, just give us a second. I'm just resending her the link. She just got cut off. Just give us a second.
Okay, she's joining now.
Okay, great. Right, is there anyone that's got any questions in the meantime for Dr. Coertzen? You're welcome to drop it in the chat as well, and we can just ask it from there.
Rasha, I couldn't unmute myself. So I think I got a message that, everybody was muted and I actually couldn't unmute myself. And then So I'm not sure if she is also battling to unmute herself.
No, she just joined
Just
the
busy.
viewpoint again.
Okay.
Yeah. Yeah. So Dr. Margot, whenever you're ready, the stage is yours.
Oh, great. Sorry, I lost my connection for some reason. So yeah, thanks, Erica. That was awesome just to hear all the kind of cases that you've been dealing with. And I think something that's really important to consider is just, as you were saying, try things out. If you listen to your patients and you observe them and you're able to, certainly with a red light, you're able to really experiment a little bit. So I'm very glad that you and your colleagues are actually using this in the ways that you see your patients responding. And I'm sure, when we say, what protocol are you using, you probably kind of saying, well, we're using the protocol that works for our patients. And that's often the way that it goes. I see. Shall I answer questions now, Francois, or later? I see there's one in the chat.
Can
I share my...
Yeah, you can share your screen. We'll answer the questions right at the end.
Okay, all good. Sorry, I'm just getting into everything that needs to happen here. I'm wondering, let me just share this in a different way. Sorry, guys. Thanks for your patience. We are getting there. Good. So I think the question really is, how can this photobiomodulation work for absolutely everything? And as you saw on that slide, I'm just going to get my bars there. Literally, there are so many conditions that we could actually be focusing on that, again, one would really ponder as to how does one thing influence so many of the systems on so many levels. And I think we're still really discovering how the body is an integrated communication system. And Dr. Erica explained that beautifully when she spoke about the fascia. So just a reminder for everyone who's thinking about how do we contemplate what photobiomodulation is doing for us, just remembering that it's allowing our mitochondria to perform better. It's blocking pain signals so that we have the right kind of messaging going via our nervous system as opposed to incessant pain talk. And then we're triggering in the tissues themselves and around the cells a regenerative mechanism. So you can see from that perspective, we've got so many ways in which we could actually utilize this technology. Something that came up very strongly in the presentation as well, in terms of this whole systemic effect, is just how people's responses are often very, very quick, very, very fast response to the photobiomodulation. And again, the question is, how can things work so quickly? And although we've been really focused on, when we talk about nitric oxide, people focus on other wavelengths of light, but it's been found that particularly the red and the infrared have got a role to play in actually allowing nitric oxide to be increased in the and cause vasodilation in the vascular system. And that has a huge benefit systemically in multiple areas. So you'll see on this slide, from helping your muscles work better to regulating the inflammatory response to helping the lungs bronchodilate to increasing your cardiovascular function to offering protection and support to the nervous system. And then also in areas of the body, the urogenital system, where blood flow is required, it can even have a beneficial effect. And the benefit of the panel and the systemic delivery is that we're targeting wide areas of the body, not just the one area where the individual maybe is saying they've got pain or they've got a skin condition, etc. So we're getting an extensive systemic response from the light across a nice range of organs and structures. And I popped this slide in because Erica spoke about the comments around her team saying that if we only had this when there was COVID, and I have people in the ICU. So there was a fantastic ICU study that was done last year, looking at how basically systemic photobiomodulation reduced the length of stay in the ICU by about 30%. People didn't lose their muscle mass as one often does, and their strength as one often does when they're in an ICU. And individuals' functional capacity actually increased rapidly, despite them being lying in bed and being sedentary. So we do wish to see these in ICU settings, but it does illustrate that photobiomodulation and the use of the panels in the way that MedWave have developed them can be used in individuals who are the sickest of the sick, to helping people who are the healthiest of the healthy maintain their performance. So we're talking about athletes and individuals who aren't sick but actually want to even enhance their health further. There's always the question around how do people lose all this fat in response to the vibration plate and in response to the photobiomodulation. And the latest thinking and the latest science is pointing back to the mitochondria, stimulating the fat cells to actually move and convert that stored fat into metabolically useful small free fatty acids that can be then used. And then the cherry on top is the combination where that individual on the whole body vibration plate, there you are increasing oxygen requirements and oxygen consumption. And when there's oxygen consumption that's increased, you need basically fuel. And so you're creating a need for fuel, and that fuel that we are needing is going to come from the fat that's being metabolized. So using the vibration plate before the red light therapy is creating a need for more fuel, and the mitochondria that are being stimulated in the fat are now providing that fuel, and that fuel is being used in the way that the body was designed to use it, which is to actually support metabolism. So it's a match made in heaven. And there has actually been research on using these two together, the photobiomodulation and the vibration therapy, and to very, very good effect. So stimulating a metabolic need for energy from the muscles with a vibration plate, and assuring really effective use of that energy by stimulating the mitochondria in the fat cells. And then they commented that the vibration therapy also has a beautiful strengthening effect on the skin. And so we're seeing contouring that is not leaving you with flabby, disformed skin as a result of losing fat, but actually you're seeing the body and the connective tissue being stimulated effectively. So I thought I'd just share those brief ideas with you. And I think we can take a couple of questions for the last few moments.
Yeah, awesome. Thank you, Dr. Margo. That we covered quite a bit in 40 minutes. That's awesome. I just quickly wanted to share, so we can go through a couple of questions and just something that, let me just get the questions up for you guys. Right, so a question from Elise is, can a patient with gallstones be treated with a light, and what results can be expected?
So there would be absolutely no contraindication. The light is not going to necessarily break gallstones down or in any way kind of remove or disturb those gallstones. But what you are going to be doing is building resilience at a cellular and tissue level in terms of the person's general wellness. Obviously, we would be looking at, again, there's going to be a benefit for general health, for circulation. I wouldn't say that we're going to treat the gallstones. That is the job of all the other therapies and approaches that the red light is going to be supporting. But it wouldn't be contraindicated, but it's not a treatment for gallstones. But certainly, please, that client would be very well served if they were going for any surgery for those gallstones or doing any protocols that were going to be addressing those gallstones. They would be served very well by doing some sessions under the MedWave before they have any invasive treatments or any stressful treatments that might come their way.
Okay. Thank you. There's also a question on depression, which is also interesting to me, and kind of what are the kind of impact photobiomodulation can have on a condition like depression.
Sure. It hits depression from quite a number of angles. Again, your brain is one of the organs in your body that has the most mitochondria. So just from that perspective, when you're actually supporting mitochondrial function, you're going to be enhancing brain functions. So someone who's being treated with a photobiomodulation just for a musculoskeletal problem will often say that they sleep better, and that means your brain is working better. And often they say that their mood is better. So in terms of depression, quite a number of angles. The release of nitric oxide, like you saw on my slide, better delivery of oxygen to the brain. The myelin sheath that insulates your nerves and in your brain, you've got your white matter tracts, which are rich in myelin. The red and the infrared light actually enhance and they really stabilize myelination because they act on the little mitochondria in the cells that make your myelin. And when your myelin, when you are well insulated, your nerves are well insulated, you think better, you can use different brain areas more efficiently. The communication pathways are, working as they need to. So what it means is that there's more neural connectivity, there's better capacity for that individual to be mentally and emotionally flexible. There's less inflammation in the brain, and that's another aspect of the photobiomodulation, is that it's decreasing your neuroinflammatory responses. Remember, your immune system is one of your major targets via the skin, because you've got a lot of your regulatory T cells in your skin, and that regulates inflammation throughout the body, including messaging to calm inflammation in the brain. So depression can often be a neuroinflammatory condition as well. So many different angles that you can actually attack the question from, but it's great for depression.
Great. Okay, there's plenty of questions popping up. We won't be able to get to everyone, but let's cover one or two more. One that always pops up is contraindications and patients with cancer or active cancer.
So I think everybody in the photobiomodulation space would love to say that we can treat cancer with photobiomodulation, and everyone's still arguing about it. And but how we approach it is that we say that basically a patient with a history of cancer is cancer-free with no concerns, someone who is about to go for treatment for cancer and might have active cancer, but they're about to go for treatment. If there's no objections from their treating practitioner who might have them on a clinical trial. So just remember, you can't, even if you want to do good stuff for a person, if they're on a trial, they have to stick to just what the trial is doing. There's definitely no contraindication because the overall health can be stabilized, and you can build resilience so that they can actually recover from the cancer treatment more effectively. After cancer, to again recover from perhaps the surgery or from the chemo or from the radiation, absolutely. So what we say is that certainly with individuals, if there's active cancer and that person is under treatment, have a conversation with their treating person. If you are the treating person and you have informed consent, you're a medical doctor and your client wants that, it's informed consent. Patients can also choose. But what we say is that if there is active cancer and the person really would benefit from photobiomodulation, cover the area, and essentially then we are not treating the cancer, we're treating the other systems that are going to benefit. There's certainly no harm in systemic photobiomodulation as a support in the whole cancer process. But we need to be team players in this with the other medical practitioners.
Okay. Yeah, one more. There's a couple of questions on visual health, you know, and the impact that photobiomodulation can have on certain eye conditions like macular degeneration, glaucoma, oxidative stress.
Yeah. So the use of photobiomodulation in the ophthalmology space is quite specific, and what's really very interesting is the very short periods of time for treatment. So it's quite different protocols than we would use with the MedWave panels. So you can use it, but there would be very specific protocols. In general, it's known that the red wavelengths of light are definitely not a problem for the eyes. And I would, if I look at the work of Professor Glenn Jeffries, who looked at the reversal of age-related macular degeneration, his protocol was 1.5 minutes, 2 to 3 times a week. So we're looking at very different protocols. Remember that the lights are very bright, so you don't want your patient staring into the panel, but that little bit of red wavelength that people do get can be extremely beneficial. But the ophthalmology space, because the eye is a very metabolically active organ, we need to be kind of discussing that more specifically.
Yep.
Yep.
That's great. Thanks, Dr. Margot. Just sharing a comment in the chat. Marina, she's also one of our providers. She said her blood pressure is the first time that it's normal in months after 4 treatments. So that's really good to hear and see that. So yeah, thank you guys. That's really a great session to hearing from you, Dr. Coertzen and Dr. Margot. Thank you for your presentation. I think before we sign off, I'm just gonna hand over to Andries for one more time. He just wants to give you a short summary and a showcase again about the technology right behind him.
Awesome, thanks, Pransha. Okay, welcome back everybody. So I'm going to show you our turnkey business and practice solution. Shortly, there's simply 5 pieces of equipment, and it's very, very simple to use our modality. There's literally 2 buttons to press. So I'm just going to do a quick rundown for you. I'm going to flip over my camera for you and show the actual equipment that gets installed. So we actually send the installer through to your practice, and there's 5 pieces of equipment we will actually get installed for you. The first one, of course, is our separate cleared photobiomodulation device, which is on a panel, hydraulic stand over there that moves the panel up and down. And you actually get a very nice remote like this that also moves that up and down. And then, of course, you also get a bed for your patient to lie on. A very nice pop-up banner that's just going to communicate the benefits of this modality to your patients. And then a very nice backlit LED marketing box. Now, this is used specifically to change the atmosphere and the feel of the room. So we install this in the room, you put a plant in the corner and a carpet, and the whole room just totally feels a bit better. The ambience improves. And then lastly, the 5th piece, of course, is the metabolic vibration plate. This device activates lipolysis. So there's a 2-part medical system here. It's firstly the photobiomodulation panel, and of course, the metabolic vibration plate. So I'll quickly show you how simple it is to use. So with this remote, you can literally just press play, and that activates the panel, which is then moved up and down with this remote. And yeah, that's it. Thank you very much, Francois. Appreciate it. Back to you.
Great. Thank you, guys. Just one last thing. We recently introduced a new panel. So our flagship panel, the contour panel, which has got a single wavelength of 635 nanometers. We have a new panel called the Nero 100S, and it's a combination of the 635 and the 810 nanometers. So if you want more information on that, we're not going to divulge everything here. You're welcome to reach out. And if you want to make use of that webinar offer, just remember to send that word offer to my email, francois@medwavegroup.com, and we will get in touch with you. So we are going to close off there. We really appreciate everyone being here, Dr. Margo, Dr. Coertzen especially. We are really looking forward to following your journey and seeing the patients that you are treating and the results that you're getting. And we are going to definitely share more of that with everyone. So have a good evening, everyone.
Thanks, everyone. Cheers.
Bye-bye.
Thank you very much.
Francois, can we capture some of the questions that weren't answered, and maybe we can just
Do you want to
answer them on Facebook or something like
let me see if
that?
I can. I'm going to save the chat. Okay, I've saved the chat. I'm going to send that to you on WhatsApp.
All right, thanks.
Dr. Coertzen, are you still there? Yeah, okay. Cool. I'm signing off.
Right. Thank you.
Yes.
All the best. Ciao.